Doctor, let's talk about heart health again and how omega-3 can help. Let's say someone's had a heart attack already. Can boosting omega-3 levels help post-heart disease?
Absolutely. The evidence is very strong on this, Scott. The best known study, and there have been others since, the so-called GC Prevenzione study from Italy. And I was asked by the investigators to fly over to Florence in Italy right after the release of this study. But they looked at large numbers of Italian men and women who had a heart attack. Okay? Several thousands, well over 10,000. And while they were recovering from their heart attacks in hospital and afterwards, they were put on the Mediterranean diet. Like you couldn't feed them any better. That's the Rolls-Royce friendly diet for cardiac care based on the published literature. And I live off the literature. They also had them on the best meds for post-MI care, post-heart attack care. You know, the ACE inhibitors for blood pressure, the beta blocks slowing your heart rate, the aspirin, the statins for cholesterol. The whole Rolls-Royce of post-MI pharmacopoeia was done on these patients. Half were on a placebo, unknown to them, it was blinded, and half were on about 900 milligrams of EPA plus DHA per day, and they were followed for the next few years. And those who were on omega-3, compared to the controls, showed a 30% reduction in cardiovascular deaths and a 45% reduction in sudden cardiac deaths, such as that umpire on national TV a few years ago who had a heart attack and died within a few minutes thereafter. These are absolutely dramatic figures. To the point now that, and I'm quoting Dr. Santini from a large hospital in Rome, and I'm getting the quote almost exactly right, but it was in the New York Times. And he said, it is tantamount to malpractice in our country to omit this important drug after a heart attack. What was he referring to? 900 milligrams EPA DHA omega-3 per day, which you can get for a few pennies all over America. Over 35% in a recent report of post-MI patients in Italy are receiving omega-3 advice on EPA DHA by their cardiologists and are on the medication, if you want to call it that. Less than 5% of post-MI